Hi Ilma, welcome to Texila American University
Thank you so
graduation
much.
event. We have a few questions today. The first one I would like to ask you is that what were your motivations, to pursue a PhD in public health?
Yeah, my motivations is that first of all, I'm in development work. I'm into development work.
Okay.
So I'm into health system strengthening. So I feel it's very necessary for me to broaden my scope.
Right.
Because one of the projects we handle is dealing with people living with HIV and AIDS.
Right.
And another one into quality assurance.
Okay.
So I feel there is need for me to go further. And also I was working at the national level.
Right.
So I feel I need to broaden my horizon, and with that, I decided, that was how.
PhD.
And also, I had a colleague
Okay.
who studied in Texila. He
Texila,
just graduated then, so he was really,
Yeah, that was my next question.
trying to,
What were your
exactly.
reasons to choose Texila?
Yeah.
Apart from that, anything else that motivated to pursue this program with Texila?
Yes, one of the things is that Texila offers internationally recognized programs,
Right.
and also the flexibility.
Right.
Like myself as a working professional, I need a place where I can be able to create a balance
Right.
between my academic goals, achieving my goals, and also my professional responsibilities.
Right.
So with the distance and blended learning programs by Texila, I was able to achieve that.
Wonderful.
Yeah.
And what advanced or analytical or public health program development skills did you gain during the program?
Yes, I gained a lot of public health program development skills. It strengthened my ability to be able to design programs,
Right.
to implement, and also to evaluate most of these evidence-based health interventions.
Right.
So I really learned a lot in terms of data analysis. Through my research work, I learned a lot about data collection, collation, reporting, and also using it.
Right.
The data use. So I learned a lot. Even though I was into quality assurance, I've really learned a lot from my research work.
Wonderful.
Yes.
And if you could remember any of the research or academic activity that influenced your professional growth the most?
Yeah, that influenced my professional growth the most. Yeah, I can see my research work.
Right.
Yes, my research work, because I'm still talking about the data analytic.
Right.
Yeah, it's really helped me a lot to deal with my professional work.
Right.
And also the research work I did on diabetes.
Okay.
So it really helped me a lot too, because we have a lot of challenges in the community dealing with diabetes, knowing when to go for testing, the type 2 diabetes especially. So the society needs a lot of sensitization. So
Right.
going into that research part, I felt very comfortable, and it has really influenced what I do.
Wonderful.
Yeah.
And if you could remember any of the support from the faculty team from Texila American University that supported you throughout your program?
I received a lot of support, from the student mentors, the academic coordinators. I can look at their guidance, their patience, their unwavering support. In fact, it is unquantifiable. Yes, they did really well. Even the supervisors at every level, from the project objectives, they look at it, to the methodology, to the result findings, everything. So they really did well. Yes.
Wonderful.
Yeah.
And in terms of the PhD, how is this PhD basically helping you in your program and the development work across Nigeria and Chad?
Yeah, I've learned a lot. It's really helping me. Like what I'm doing presently, working as the program development specialist. So I've learned a lot about public health program planning. Even though from my previous work, I'm not just into health, I'm into both health and education.
Okay.
Because there was this level I worked as a quality improvement specialist,
Right.
where we try to look at the provision of quality services at the
Right.
facility and at the community levels.
Right.
So looking at these services at the community level, we look at civil society organizations providing services to people, to orphans. Yeah.
Right.
So at that level, we check their education components, we check enrollment, retention, and completion. We also check HIV testing and the rest of them. So it really helped me a lot. Yeah,
Right.
yeah.
Absolutely.
Excellent.
And if you could remember any of the challenges did you encounter during the doctoral journey
Yeah.
and how they were addressed?
Yeah, I encountered a lot. In fact, one of the major one is balancing my academic work with my professional responsibilities.
Right.
It was really tasking. At a point, I felt like dropping, step. Yeah. So I was really motivated. My sister, I have a loving sister who kept on motivating me, a loving brother-in-law who kept on talking to me in person of Dr. Ibrahim. They really did a lot to ensure that I succeeded to the end. So with that, I was able to re-strategize. I was able to prioritize some of my activities, and it worked well.
Wonderful.
Yes.
Great to hear.
Yeah.
And finally, what advice would you like to share for the aspiring PhD candidates?
Yeah, the aspiring PhD candidates is to be patient.
Right.
Yeah. They should take things slowly. You come in with a lot of hopes,
Right.
feeling maybe it's just, but as you are moving, you realize that there are a lot of things you need to do. There are a lot of obstacles on the way. So there is need for consistency.
Right.
Yes, there is need for that. So with that, I feel they will be able to overcome, and they should also try to improve their communication skills with their
Right.
mentors.
Right.
That will help them a lot. Ask questions,
Right.
interact. It helps a lot.